it is my honor to introduce a physician who truly represents the future of regenerative medicine. Our speaker is a double board certified doctor who has dedicated his career to helping patients not just live longer, but live stronger, sharper, and more vibrant lives with advanced expertise in exosome therapy, hormone replacement therapy, peptide science, and targeted nutritional supplementation. What sets him apart is not only his clinical mastery, but his commitment to education, as he is the author of 2 books focusing on optimizing health and longevity. His approach is thoughtful, evidence-based, and rooted in the belief that aging is not something we should simply endure, it's something that we can actively influence. Please join me in welcoming a leader in regenerative and longevity medicine and an advocate for proactive health optimization, Dr. Raymond Adamcik.
I'm very excited to be here to tell you about the greatest and latest innovations that's revolutionary here. So you've heard of stem cells. A stem cell can turn into any cell, but also can send messages to these cells how to repair themselves. And those messages are called exosomes. They're natural products. They come from umbilical cords. They harvest the stem cells, and from those stem cells, they get the excretions, the exosomes, so they concentrate them, they purify them, they make sure there's no contaminants to them, and then we can, in my office, inject these into your veins. Particularly amenable, this is autoimmune type disorders because it resets the immune system. In general systemic inflammatory conditions, especially neurodegenerative conditions like Alzheimer's disease and Parkinson's disease, chronic musculoskeletal issues, and just general tissue regeneration. So a lot of people could potentially benefit from this. Some people require more if it has like an advanced neurodegenerative condition or it's a lot of inflammation. They might require a double dose to kind of get the response out of it. This treatment is considered experimental. It is not FDA approved. There are no studies. You just do it at your own risk. Generally, it's considered to be relatively safer than stem cells in terms of like the general minimization of potential allergic reactions or other reactions to that. So, this is the basic technology of how it works. The stem cell releases these exosomes, which are the signals, and these signals then go to the cells and tell the cells what to do, how to repair themselves. I've been suffering from a neurologic condition called Charcot-Marie-Tooth. I started it earlier on in my life, but I became aware of it in 2007. I was diagnosed with it. And what it's caused is a progressive loss of sensation and motor function from my feet all the way to my ankles. And I developed a foot drop 5 years ago. I was advised to use a foot brace. I was advised to use a cane. And I tried everything at the Anti-Aging Self Conference to try to help. I just couldn't take it anymore. I couldn't deny it anymore. I just want to demonstrate this is actually a pretty cool cane because it turns into a seat. It got me a lot of attention at the Anti-Aging Center. But it got the attention of a fellow named Richard, who looked at me and said, "What's up with your legs, man? What's the problem?" So I explained it's like a neurologic problem. So he said, "Well, you can try exosomes." I'm like, "Well, what are they?" And 1 month ago, I had my first injections of exosomes. Now, I was hoping maybe it would do something about my legs. What I wasn't expecting was that for the 2 weeks before that, I had some helps with brain fog and concentration and stuff like that too. So I got the treatment, and fairly quickly after, my brain function got better, my focus got better. Like, it's too soon, just maybe it's in my head, but it's persistent. In fact, it's gotten better, that my focus has gotten better over the last month. My brain is like on fire. Sometimes I can't even stop it. I'm just so busy making this conference and things like that. But then my legs, the sensation started to improve down my legs. And first it was, now it's only down to my ankles. Now it's only the top of my feet. Now it's only the bottom of my feet. Now it's only the toes, and now it's gone. Because I went on vacation to the Bahamas. I put my feet in the sand, and I went, wow. It feels so good to feel to sit there, my feet in the sand. It was hormones at the root of my problem. And when I found out the treatment, it changed my life. It brought me back my life, my energy, my mood, and I said, oh my God, this is a miracle. If anti-aging can do this for me, what can it do for the next 5,000 people that walk through my door? And I found miracle after miracle, broken people that I was band-aiding their symptoms with pills, oh, you can't sleep, you need Ambien, you don't have energy, you need Prozac, you're nervous, you need Xanax, just another pill, never getting to the root of the problem. When I finally got to the root of the problem, then all the symptoms went away, but the patient got much better in terms of their general health and prevention of disease and longevity, which is what I'm shooting for. So when you go to the conferences, there's 1 in the morning, and then there's 5 branches in the afternoon. I can only go to 1. But what I do when I come back, I I print out the other 4 and I study the other 4. So this is what I normally study when I come back from a conference is all of this. But I took this stuff seriously because it changed my life and it changed everybody else's life around me. So when you go to the talks about many products, the latest innovations, I'm always looking for the latest and the greatest stuff to bring back to my patient population. And I'll do anything for it. I'll go in hyperbaric chambers, I'll sit in salt bags and stuff like that. But those things didn't work like exosomes and hormones and peptides. My son Ryan, who's a physician's assistant, and Dr. Herchow, the world leader in anti-aging and hormone replacement therapy. And a lot of people want longevity, but they go, with a little asterisk to it. I want longevity, but not if I have Alzheimer's disease, or not if I have some chronic illness, So that's where health span comes in. And that's what we're trying to do in my office, is to improve the health span of people. And now I need to apologize to all the women in the room and in America that we effed up badly when it comes to health span over there. Because, well, one thing, we don't study women. 90% of tests are in men. We don't care about your health. We don't test your health. We don't know anything about your health, right? Not only worse than that, we gave you bad advice. In 2001, we said estrogen causes breast cancer. And women listened to that. And for the last 25 years, my whole generation, anybody between 50 and 75, was told that estrogen causes cancer and don't take it. And the result is catastrophic to our population. Because of that loss, then many millions of women will get Alzheimer's disease, osteoporosis, weight issues, poor quality of life, and that's where the health span we screwed up on women. And this is further evidence that this evidence has been out there all along if you opened your eyes. And this is just a recent study that showed that women that took hormones, they lived longer, they had better cardiovascular health, they had less cancer, they had better brain health. The evidence has been there if people just only opened their eyes. And that's what we do here in my office. Because men hormones are equally important for men. And if they don't have hormones, well, they're gonna die. They're gonna have more mortality, more heart disease, more diabetes and metabolic burden, and poor quality of life. So that's to try to improve health span. We gotta get the estrogen and the testosterone right in women so that they have better quality of life and prevent those degenerative illnesses. Now with stem cells, we can reverse the degenerative illnesses, but now we have to prevent the degenerative illnesses with this treatment. I've been like a cholesterol fan when everybody's on the other side of the fence. This is one of my earlier books. And just forget that cholesterol is not the demon that it's deemed to be. Cholesterol is necessary for brain function, for cell membranes, for vitamin D, to make hormones. It is really critical. And this study, probably not seen, cholesterol, longevity, and intelligence. When I first started practice, I had patients that were 80 years old, had cholesterols of 300. I was like, oh, you need a statin, or you're gonna get a stroke, you're gonna get a heart attack, but these people never did. In fact, they were the healthiest patients in my practice. And then I would have the diabetics that are low cholesterol and say, oh, congratulations, your cholesterol is low. But what that means is that in these people, they started at 85 years old to get in this study, a prospective study. They found that people with higher cholesterol lived longer and have less problems with dementia, and that lower cholesterol was an indication for higher mortality and higher risk for dementia. The opposite what everybody's being told. 2007, the world's best diet. And in this book, I called out the medical profession. I said, the pyramid is wrong. That all these grains on the bottom is wrong. You're poisoning yourself with sugars, right? And it says the metabolic syndrome, that's pre-diabetes. I was talking about pre-diabetes before it was conditioned in 2007. It was not a word yet. So I've been an expert in this, not attacking cholesterol, but attacking sugar. So I've been a proponent of metformin, which is a metabolic stimulant, helps with metabolism, helps with insulin sensitivity, helps with diabetes. It's for longevity, it helps decrease cancer risk. So it's my number 2 longevity medicine in my office. So I have important things to tell you about peptides. Number 1 is know what you got. There's a lot of stuff you can buy on the internet, many different sites, right? But these companies are not regulated. We use 503B pharmacies. So these peptides are by prescription, and I know that what the quality it is. I know it's not contaminated. I know there's no bacteria in that. I know what it is. But you can take anything else, and there's no monitoring whatsoever. There's nobody says, hey, wait a second, this isn't BBC 157. Oh, wait a second, this is contaminated with this. Wait a second, this is bacteria. You're just taking something random. So unfortunately, I can't recommend random things. I can say, well, take it, but I don't know what it is. Is the GLP-1s, which includes a semaglutide and tirzepatide. And so why is that? Well, because there's some fabulous things. Now, of course, they help greatly with sugar metabolism and diabetes and prediabetes, but also they help greatly with weight. So, well, of course, you're not getting diabetes, you're not getting overweight, but also they stimulate the area of the brain, the hippocampus, to make new brain cells and reduce neural inflammation, improve mood. So the people who took it got significantly as Alzheimer's disease. So much so they're experimentally using it to treat Alzheimer's disease. Plus reduce systemic inflammation, decrease heart attack and stroke risk by 26%, decrease fatty liver disease, and decrease end-stage kidney disease. So if you don't get fat, diabetes, Alzheimer's disease, systemic inflammation, cardiovascular disease, kidney disease, or liver disease, you're not dying that quickly.
Yeah, we know.
NAD is necessary to metabolize glucose and fatty acid. Here's NAD, helping to make energy, but you gotta have NAD to make energy. So what happens is that people age or mature, they don't make NAD as well. So you can supplement NAD to help with energy system. So it's pretty cool what it actually does. Now we have it also oral form and sub-Q injectable form. We can also get a sublingual form, I think. So I've been using NAD for about 6 months, and I love this stuff. What it does is that for me, you can use it as needed for energy, but I'm an energy pig. I want energy every day, so I do use it every day. And what happens is that I use it in the morning and the afternoon. It gives me my afternoon back. In the afternoon, I'm going to the gym, and when I'm there, I do some extra exercise because I'm not really even tired yet. And when I go home, I don't know what's up with me, but I start doing housework and cleaning the house and stuff like that because I still got some energy. What am I, crazy here or what? So C157 is a magical healing peptide. It actually comes from stomach cells. And when stomach cells are injured, they send a signal out to other cells around it, gee, there's something going on here, and other cells get stuck in a frozen state. So the BCPC tells them how to get out of that stuck frozen state and reduce the inflammation, get back functioning. So it turns out that not only stomach cells work with this, but all cells in the body respond to this healing message. So it works for these various pathways for inflammation, but results are really fabulous. It can really help the repair process, reduce inflammation, and I find it actually helps with bodybuilding because when you bodybuild, you tear and then you repair. So you repair more quickly. I also find it has mood elevating effects, so it's really fabulous. We have a couple forms of DPC-157. We have oral form, and that works really, really good. And then we have also injectables for high potency healing, you got something that's really inflamed, your whole body feels inflamed. And then we also have local injectable with TD500, like your hip, it's your knee or your shoulder or something like that. So it's a really fabulous healing peptide. It is IGF-1 LR3. Now this one is a little tricky. Everybody's heard of growth hormone. Growth hormone works, but growth hormone is very expensive right now, running about $600. And what growth hormone does, it stimulates the liver to make IGF-1. And IGF-1 does about 70% of the actions of growth hormone, including the most important parts, which is burning fat, making muscle, and improving brain function. And what it doesn't do so well, some of the skin and hair stuff that growth hormone does, so someone will go forget it, if it's not going to do skin or hair, I don't want anything to do with it. But it does do kind of the body composition stuff over there. And I found it really excellent. I've been using it since about 2013 on and off, and I used it this morning. Now, one of the potential side effects I have to warn you about with this one is superior intelligence. We have CGC 1295 with Morlin. This is a very popular peptide, and what it does is increases internal production of growth hormone. So now you can take growth hormone externally, or you can make your own body produce it. And there are a lot of experts that feel this is a preferable method to stimulate internal rather than supplementing external. You supplement external, you shut off the mechanisms there. You alter the mechanism. Some people think it's safer. So we've had really excellent results with this one, particularly for bodybuilders. It seems to be the best for putting on muscle. It's not the cheapest of them, but also it has all the effects that growth hormone does, which is help in terms of general quality of life, mood, general well-being, burning fat, making muscle, helps with skin, helps with hair and stuff like that.
All that protocol right there.
Yeah, it's really fabulous. ARA290, which is a new peptide, which is unique for helping in terms of nerve function. So again, this is right up my category, but for people that are looking for nerve results, this is a new one that helps with nerve regeneration, helps with small fibers, reduces inflammation, and it's just now available. Now it's brand new.